We are back again with another special guest. I'm so honored to be sitting here with Dr. G a few days before what we all know is happening on Monday, June 5th, and that is Weight Loss Her Way. This weight loss topic never gets old. And as a matter of fact, the excitement is elevated because now before us, we have Dr. G of Face It by Dr. G. And our focus is going to be on taking some time to understand vitamin shots, weight loss shots versus weight loss medication. And by the end of this conversation, you'll know exactly what day Dr. G will brace us with her presence and help us get well. So, Dr. G, please tell us a little bit about you and your company.
So my name is Dr. Janelle Grandison. I am a doctor of nursing practice. I'm currently working as a nurse practitioner. I do have my business, Face It by Dr. G, where we provide IV hydration and wellness through our Face It hydration services. So we work to partner with Black-owned businesses, women, spas, and other medical facilities to provide an expanded variety of services, including weight loss injections, as mentioned, wellness injections, and hydration services. I have about 10 years of healthcare experience. I have my doctorate from the University of Maryland, Baltimore, very proud of that. And yes, I'm happy to be here today talking about this exciting event.
Yeah, and wellness for women is, although it's somewhat trending, it never gets old. And we don't talk about it enough. We know that vitamins are important, but I think that sometimes we get so caught up in our day that without the reminders of how significant vitamins are and the power of vitamin shots. So tell us a little bit about that.
So vitamin deficiency overall has a significant impact on health. A lot of the common vitamin deficiencies, a lot of us know about the vitamin D deficiencies, calcium. Less familiar is, probably magnesium. But for example, if we start with the most common vitamin D, especially for melanated individuals, we are not able to absorb vitamin D as well from the sun. And then on top of that, a lot of people aren't getting enough sun. So vitamin D deficiency has been associated with impact to your immune health, your bone health, and your risk of falls and having a fracture from a fall. So this is one supplement that we definitely recommend be replaced because it has such significant impact on health. Other vitamins include B12. B12 has an impact on cellular function. So this helps with some anemias, not quite iron deficiency anemia that you would actually need iron for, but B12 does help with a cellular component in your red blood cells and helps reduce some of the symptoms associated with anemia, which can be, numbness, tingling, et cetera, and an affect on the muscles. So these are some supplements that, even though people aren't deficient, function better when the levels are higher.
Yeah, that was an excellent explanation, especially with vitamin D, and not to mention B12. Not too long ago, I had the B12 shot. Thank you very much. I definitely enjoyed the perk in energy. That felt amazing. And as we get older, the need to make sure that we're consistent with supplements because the body changes over time. And thanks for highlighting what happens as we age to really consider how supplementing can help us from a health perspective. Now, the weight loss shot. So let's talk about that wellness side of it. And if you could walk us through the difference between a weight loss shot, who would be a candidate, and versus weight loss medication.
So there's several weight loss medications on the market targeted for weight loss. So the most popular right now is, as a lot of people have heard about, the Ozempics, the Wegovy's. These are weekly injections. There's also Contrave, which is a pill form of a weight loss medication that's also FDA approved. These medications, anything that bypasses the stomach always works better, but there is always associated side effects. And I think a lot of people shy away from weight loss injections because of the side effects, or even the oral medications, because they read the side effects and they say, well, I don't want that. But if you think about how the medication works, you'd very much understand and also expect what some of these side effects would be. So for example, and I'll use the generic name of Ozempic or Wegovy, which is semaglutide. Semaglutide is an injectable medication that slows down gastric activity. So for example, the goal of the medication is to keep you fuller longer. So how does that work? You ingest something, it kind of sits longer, it takes longer to move through the GI tract. And so the result of that is you might feel nauseous, you might feel bloated, you may have constipation. And these are things that are all expected if you're slowing things down in the gut, especially for people who have heartburn or reflux, or GERD is another name. If you're eating and the food is kind of sitting there, which is the desired action for you to eat less. So if the food is sitting there and then you go to lay down, you might have more symptoms from your reflux. So now you have to be cautious or cognizant of, eating and then laying down. So a lot of times the side effects kind of deter people, but there's ways to mitigate and offset some of the side effects to ensure that you're actually benefiting from the medication and not giving up on it too soon. We do recommend a medical consultation before starting any weight loss supplement, whether that be with me or with your primary care provider, because we do want to iron out some of these details to ensure the success of the weight loss program.
And you hit it right on the nose. The whole time I was thinking, wow, how we know how important is education.
Mm-hmm.
That it helps to take the myths out of it and really assess whether or not it's for you.
Mm-hmm.
And the way that you explained it, of course, just understanding that in any case, like you, just as you mentioned, when the body slows down, okay, what happens naturally as a
Mm-hmm.
result of that? And that these side effects, in comparison to the long-term outcomes that we're looking for, may be minimal, pending a person's circumstances. So if you could rewind us back a bit, the wellness shot, the weight loss shot, exactly how does that work?
So the weight loss supplement that we have is called our Mix Skinny Shot. And that shot is, as the name implies, it's a supplement. So this is not a drug. It's a supplement that works with your body to increase your metabolism. So this is great for people who are already working out, who are already actively trying to eat better. It's something that can aid your weight loss. Some of the pharmaceutical medications like we talked about, the semaglutide, you're going to lose weight regardless of physical activity. The mix shot really requires some physical activity to help your body and your metabolism. It also curbs your appetite significantly. So that's another thing, you'll be eating less or maybe snacking less, craving less sugars. So it's a great alternative for people that either the weight loss medications are contraindicated, or if they would rather not have the side effects or just don't like taking medications, which a lot of people don't.
Wow. So they sound like they could be even a good jump start.
Mm-hmm.
And at the end of the day, especially at Amani Nicole Wellness, that our first priority is habit change, the behavior change, naturally changing our eating habits, naturally desiring to move more. So it sounds like the weight loss supplement could really be a kickstart to someone, especially in light of getting ready to rev up for the fitness side of the journey. Wow, that was awesome. Thank you for simplifying it and breaking that down as well. Now, on June 5th, the Weight Loss Her Way, we have a number of ladies who have experienced weight loss success through lifestyle changes, bariatric surgery, weight loss medication. Um, and there are a lot of tools out there to help us to reach our goals. Because you won't be able to attend at that event, but we look forward to what's coming up on June 15th. Tell us, Dr. G, what would you share with our audience on June 5th as we engage in this conversation about weight loss and how it impacts us as women?
I'm actually glad that you brought up the bariatric surgeries, because this is one of the specific surgical procedures where you're reducing the surface area of the stomach. So now your nutritional absorption is less, your vitamin absorption is less. So weight loss, not weight loss, wellness shots are actually great for these groups of people because you're bypassing the stomach and ensuring that you're receiving all of the nutrients 100%. So this is great for those individuals coming because we will have these wellness shots available. We have vitamin D, vitamin B12, vitamin C, biotin, folic acid. So we have a variety of options available for injection, which we'll have at the event.
I know they're looking forward to it. As a matter of fact, at the Weight Loss Her Way event, we're excited. We'll be doing some giveaways for some gift cards to ladies that they will be able to use at the June 15th, Thursday, June 15th, from 3 to 7. Face It Hydration and Wellness shots will be available exclusively at Amani Nicole Wellness by Dr. G herself. We're excited about that. Um, what does that day look like? We're going to open up registration for June 15th as early as tomorrow. So tell us, what can they expect? Is there anything they need to do special? How do they prepare for their wellness session with you?
Right. So all of the vitamins that we offer are what we call water soluble. So you can't get too much of it. So if you're already taking something, you don't have to stop. But the benefit is once you get your injection, you'll be good to go for at minimum a week. For some people, it could be a month, depending on the injection that you get. So there's no need to really change anything that you're currently doing prior to the event. During the event, we'll have 2 pages of a form to fill out. One will be a brief medical history and the other one will be the consent for anyone getting an injection. And then you just make your choice. We will have more information about all of the injections and what they do. And there's also more information on my website if needed, but we will be curating something for Amani Nicole so that everyone knows what they can expect.
We are so excited. But on June 15th, the focus are the wellness shots, but there's a lot of talk about IV hydration. So if you could just give us a little snippet, exactly what is it? Who is a candidate? How do we benefit from it?
So Face It Hydration has 19 different drips that we offer. We have energy drips. We have the Myers cocktail, which is the gold standard drip that has basically a multivitamin in a bag. It's good for 4 to 6 weeks. So for anyone that hates taking multivitamins every day, it's the perfect cocktail. We have everything down to migraine cocktails for anyone suffering from migraines. So we do have a lot of options for drips, athletic drips for people that are working out in the gym and want to replace those amino acids or need that mineral blend pickup with your magnesium and your calcium. So we have a wide variety of intravenous therapies. Most of the drips are anywhere from 30 minutes to an hour, depending on the size of the bag and the type of drip that we personalize.
Wow, our access to what we need is just it's widening. We're bridging so many gaps here. And I just know June 15th is going to be the beginning of an amazing collaboration. So, I am personally excited. I've experienced the wellness shot. I experienced my B12. I experienced the weight loss supplement, and IV hydration is on my list. I'm going to be the first one when we roll that out. So again, look out for our registration link. You're going to see some hype and buzz around social media. Our clients that are already with us will get a chance to jump in right away with the scheduling. So again, Dr. G, can't help but express again how excited we are to be able to have you. Thank you for dropping those gems. We're super excited. We want you to enjoy this next week or 2 weeks or what have you, and get pumped up and revved up, because on June 15th from 3 to 7 p.m., we will definitely be in the building. So thank you again for keeping us well.
Thank you. Thanks for having me.